Hi, I'm Ron Pollack, Executive Director of Families USA, the National Organization for Healthcare Consumers. I wanted to share with you some thoughts about what the elections mean in terms of the future of healthcare. And I think there are four takeaways. The first takeaway is that Obamacare, the Affordable Care Act, will be implemented. No longer are we going to have this debate as we had throughout the year before the Supreme Court ruled and before the elections as to whether Obamacare will be implemented. Now our challenge is to make sure that it is implemented effectively. And specifically, we've got to make sure that the tens of millions of people who are currently uninsured actually get enrolled. And that means a broad public education campaign and a good implementation process to get people enrolled. Second takeaway is that the Medicaid program will expand. It will expand because the Affordable Care Act provides generosity to the states from the federal government that's unprecedented. 100% funding for those newly eligible in the first 3 years, and thereafter it never goes below 90%. Now our challenge is to make sure that that significant improvement in what the states will be getting in order to expand their coverage, that does not get undermined. And that means that in the big budget fight that lies ahead, we've got to make sure that the Medicaid program is not cut. The third takeaway is that the Medicare structure is now stable. We're not going to see anything like a voucher type system. It means that the guaranteed coverage and care that Medicare provides will continue. And now we've got to make sure that the Medicare program provides services as effectively and efficiently as possible. The fourth takeaway is that while all these changes are taking place, we've got to make sure that America's healthcare system is run as effectively and as efficiently as possible. Clearly, we've got to make sure that people get care on a timely basis, that we don't pay for care based on volume of services, but on the quality of services that people should receive. And that is the key agenda that all of us need to pursue in the months and years ahead. So 4 takeaways. Affordable Care Act will be implemented, and now we've got to make sure that it gets implemented well. Medicaid is going to be expanded, but we have to make sure that the budget fight does not result in cutbacks to the program. Medicare is going to continue to operate as a guaranteed benefit system, and we have now got to focus on making sure that America's healthcare system is as effective and efficient as possible. We look forward to working with you in the months and years ahead to make sure that this agenda is implemented as strongly as possible. Thanks so much.